we're going to talk about eczema as it relates to three things. 1. Skin flares related to COVID or COVID jabs. 2. Food intolerance and food triggers. 3. Different kind of presentation that makes you think, is this eczema or is this psoriasis? The first topic is about skin flares that come about because of a COVID jab or because you come down with COVID. This was very, very common in 2021, 2022. We see a lot of people coming in with red face. You can call it post-COVID red face syndrome. Very, very common. And we use Chinese herbs pretty well to treat them. So there's this patient who came in. She had a COVID jab about 2 years ago, and since then she started having her face flare, face and neck actually. And it was clearly the jab because she never had a history of eczema. Never. I gave her herbs for that, and within 2 sessions, she stopped coming back. So of course I didn't remember. 2 months later, she wrote back. She said, hey, the herbs helped then, but now I'm flaring a bit more. So my thought was, okay, the herbs may have helped, but maybe it did not help fully. So we had a consult. The consult made me realize that actually the herbs helped the post-COVID face flare because it was mostly gone. What happened was some low-level stress and eating of chips, overnight oats, and also biscuits. These are all common food triggers. So she realized over time that after eating cassava chips, she would flare a little more. But what's interesting is that the flare was of a different type. I talk about this in a video here. We talk about psoriasiform dermatitis. And you'll find out more because it's kind of hard to distinguish a psoriasiform kind of eczema and a psoriasiform psoriasis. And I realized that, hey, the presentation is now different. It's flaring, and of course the food triggers are flaring her, but look at these circles. So these may be early stage discoid presentation, but most likely not, because most times when discoid presents, it's a circle that gets bigger and bigger, or mini circles that coalesce and become a big circle. These are big already. Of course, the formula has to change, and we gave her the formula. And I'll leave you with a video on psoriasiform spongiatic dermatitis, PSD. Hope this comes useful, and have a good week ahead.